Yeah, you're pretty.
I am Brent Sturm. I am a recreation therapist here at the Huntington VA. I work in a couple different programs here at the VA. We try to offer different types of therapies to help our critically injured and disabled veterans. We offer a variety of programming that you wouldn't typically see, pet therapy being one of those. There's adaptive horseback riding, and we do aquatics and art and fly fishing, and we do some active stuff, snowboarding and whitewater rafting, things that we hope that we can make a difference in a vet's life, teach them to do something with their family and friends out in their community, you know, because their functional level is much different, and their family interaction is different, and their community involvement is different. We're trying to just teach them ways to do other things.
Well, I'm with the Therapy Dog International. It's an organization that's all across the United States. It started in 1976 in New Jersey. And so we are tested, we're associate members, and Digit had to pass a test and be certified to be able to do this.
What's her name?
Digit.
Well, you're pretty. Beautiful eyes.
Therapy dogs are wonderful if they are used for the right purpose. I have ran onto some people that doesn't understand that these dogs need to be tested and certified. They are not allowed to go into restaurants and stores and some certain places like a service dog is allowed to. I cannot take her into Walmart or a grocery store or anything, but a service dog could go. By law, they are allowed to go. A service dog is trained to work a specific task for, say, like someone that's blind or handicapped, special needs. And that dog needs to be focused on them, their handler, where Digit is a therapy dog. She's there to be petted. The service dogs aren't supposed to be petted that much because they need to focus on their job. Digit is a therapy dog, so she's to be petted and loved on. With Digit, she also has a bandana on that says she's a therapy dog. She has her little yellow tag on that says she's a therapy dog. And then when we are out, we have to wear this for her ID. Where service dogs, they just need to have their vest on. Well, with Digit, we started out, we did basic obedience training. So basically, sit, stay, down, stay, heeling, being able to walk in close quarters, come when called, and then when I started doing the therapy work, then I started desensitizing her to I had a homemade IV pole at home and a wheelchair, a trash can. And so we was constantly walking around those and getting her used to being bumped by them. And I would tell her, watch me all the time, and she would get treats. So that way she trusts me when we're out into a facility. She knows to watch me, and she's not watching other things to get distracted or get in trouble. And I can lay food down in front of her and she won't bother it until I release her, so that's good. And so it was just a lot of my imagination of thinking of different situations we've ran into that I took home and practiced with her. So I desensitized her to it, and she's very used to anything. Oh, you know what's in my pocket, don't you?
I want a treat too. Wait a minute, is that all you got to do? I actually have a friend that just went in a nursing home, and she had a cat, and they made arrangements, do all the things for it, and now it lives with her in that room. So it's a big help to her, and just like she's still home. So yeah, I'd recommend it anytime.
I knew it was something that I thought would be very useful here, and I'd looked around for a little bit, and Teresa and I got in contact with each other. I don't even remember how that happened now. It's been like 6 years ago, but they came out and we did a talk with the bigwigs here, trying to get everything approved, because you bring a dog into the hospital and people were confused and worried and didn't know what to expect of it. But within the first week, we realized what an amazing program it was going to be, and we've kept going. And like I said, I think we're in our fifth, sixth year of doing this now. And the interaction's amazing. The vets love it. The staff loves it, and it's been a very big asset to the hospital here.
So beautiful. You're a beautiful girl. Oh, beautiful. I miss my babies so bad. kids. I wish she was up here in the room with me. I'd feel better.
Well, she'll be coming up on the floor and visiting.
I'm on the field.
Fifth. We come up on the 5th.
Oh, you're so beautiful.
They have to be very laid back tempered.
Oh, God.
And with her, she is used to being around medical equipment, noises. She can sit, stay, down, stay. She knows how to walk by food that might be dropped on the floor or medicine and leave it. And she has to tolerate like rough petting. So some facilities we go in, the patients don't realize how roughly they're petting her, so she has to be able to tolerate that. And loud noises, just a whole list of things.
Raise your head up here and I'll take that off there for you.
And what's her name?
Digit.
Digit. Hello, Digit. She could probably do that all day, couldn't she?
Yes, she could. She does, really. A lot of days we're out all day long. Digit's 11 and a half years old. I've had her since she was 12 weeks old. She's been doing therapy work since she was 2, but certified with TBI since she was 5. We have been coming here to the VA for 6 years. We go to numerous nursing homes, libraries and hospitals. We do a reading program at the schools where the kids read to her. We go to special needs classes. So she's pretty well booked. She has her own calendar. I also have another dog at home, another Old English sheepdog, and Phineas has been certified for the last 4 years. So I switched them out on which dog will work in the best situation.
Is that the natural prize?
Both blue.
Popeyes.
It's called walleye or China eye.
Really?
In this breed.
Oh my.
It's rare.
I want to be careful I don't get a girlfriend like that. I wouldn't know which way she's looking.
We go to different waiting areas, hospital waiting areas, just people that are nervously waiting on their loved ones and trying to see what's happening, and we're trying to get them away from that uncertainty and fear, and they see the dog and they think about their dogs or something that's happened in the past, and they want to say hello, and it just puts them in a better mood, and it gets them talking about things not in the hospital. It gets them interacting with each other in the waiting area. You walk into a waiting area that's completely quiet and everyone's just sitting there and there's 15 people not talking, and then by the time we leave, they're all talking to each other and laughing and telling stories, and then you go into a patient's room and again, they're laying there, nobody likes being there, everybody knows what that's like, but the dog comes in and all of a sudden there's a smile on their face and they're telling stories about their animals, and it just puts them in a better mood, and we've got the data showing it does lower blood pressure and increase mood in that, and it's good to have that, but just the smiles you get. And Digit seems to know, like the people that can't quite reach her, she'll lean up or lean into someone, and it's amazing the interaction that she just inherently does.
She's wanting that in petted too. Oh. She wants you to pet that in.
Oh, she does?
Yes, she does. That's how you know she really likes you.
Is all girls like that?
I used to be afraid of dogs, and I got involved with dog obedience, and I had a friend that worked at a nursing home, and she was like, hey, could you bring your dog to the nursing home and interact with the patients? And so I went in not knowing what to expect. And then when I seen the results, I started educating myself and working with my dogs to get them certified to do this. This is my 8th therapy dog. So 20 years of doing therapy work. And kids will read to her without a problem, where they have problems with reading to an adult because the dogs are non-judgmental. And Brent and I have seen patients that doesn't like to interact with us, but they will open up to Digit, and she works the magic.
Hi, pretty girl. Oh my goodness. Oh, golly, I'm gonna have a big doggy fix. What a pretty girl. You're a pretty girl. Yes, sir.
I'm originally from Lawrence County, and so I've traveled to Huntington and like the neighboring counties. If we get the call, a facility calls us, we usually travel. No matter how far it is, we feel that there's a need, we try to fulfill it. And so like I said, I used to be afraid of dogs, and I got involved with dog obedience, and it has just snowballed ever since. when you see the difference that they make in someone's life.
But you want to get better and be with with your own animals and your own family and things. And it keeps you from getting lonely. And I think it would do a lot of them real good. It asked me just to be with the dog today. And it made me twice to be with them. And they couldn't be nothing no better.
We've had other dogs come and go, coming through like for a little bit here and there. Some have come with Digit to shadow us and go through, and we used to bring a couple at a time. The consistency of Teresa happens to live close to us and is able to come here, and she volunteers her time. That's the only reason. We do have others, but it's a certified therapy program, so we do our best to have a certified dog.
Started off with, she wasn't always this laid back. The first 2 years she was very energetic, but it was with the persistent training and teaching her and exposing, socializing her. And so I look for a dog that's got a very simple, easy, laid back temperament. And I've just been fortunate to have had 8 of these that has worked for therapy dogs. But once the light bulb went on for her, she has been outstanding to work with and to train. She trusts me so much. But she recently went blind in her left eye. And the vet said to continue on. I asked him if I should slow down, and he said no, to keep going. And so we continue on, and he said even if she does go blind, as long as she's physically able for me to continue on, because she loves this work and she trusts me. So that's our plans. So we're not going to slow down anytime soon.